we're going to do sternum first, then the SC joints and ribs last. So, sternum. And the ID blocker can be up or down. It's going to be out of the way either way. Well, actually, you're going to be using a detector and don't have to worry about it anyway, so never mind that. But, Pamela, how about you come up and let's have you take your sweatshirt off. So, we're going to do a PA oblique and a lateral. I'm going to have you come right up to that upright wall bucket and face it. All right, and really, I'm going to have you step out of the way just for a second. It's best, really, to get this right marker on. You're going to be using 2 different markers, 2 different SIDs, 2 different breathing techniques to your patient. But just get that right marker on. All right, and let's bring you right up here. You're going to be facing the board. And then this arm is going to be up here, this arm. In fact, I'm just going to have you grab that. All right, and then we're going to smash up against the board. Then we're going to have you look this way, and then we're going to rotate you 10 to 15 degrees. And we'll just let's put your chin actually on the board. Because what you try to do is smash your patient in, because the sternum is really hard to visualize. Smash them in to the board. And then, so 10 to 15, I'm just going to have you, I always want to relax this down just a little bit. We're to oblique. There we go. 10 to 15. And then center ray is level of T7. And 1 inch lateral of MSP on the elevated side. So spine, we're going to move you over just a little bit. There's that 1 inch. Oh, you know what we should do? I'm sorry, turn around. Turn around. Find your jugular notch. Just put your finger on your jugular notch. And take the light and put it about right there. And you're going to be good. That's really the best way to start. All right, now let's turn you around. Let's get you back up there. All right.
You're literally right in the way.
All right. Spine. Just a little bit. Just like that. All right, we've got our sternum on there. All right, and then Pamela, I'm going to give you a breathing instruction and make this x-ray. Take a big breath in. Blow it all the way out. Hold it out. Don't breathe or move, expose. You can breathe and relax. And now one more x-ray, but I'm going to have you step over there to the side just for a minute and see what you want to do is you just want to change your markers now. And then do you need to go up and down? No, because you're at T7 on this one, you'll be at T7 on the next. So there's no need to do anything there. Then 72 inches. All right, this is a side view. I'm going to have you come up and face that wall. And now let's bring your arms behind your back and clasp your hands together and just kind of arch your back out. And make sure she's in a true lateral. And then here's chest wall, right? So follow it down. It's just to the step you forward just a little bit. Base, I just say base of the breast. You want to make sure you're going through bone, right? So make sure that's where you're going through. And then again, one more breathing instruction, Pamela, and we'll take this x-ray. Take a deep breath in now, deep in. Hold it in, don't breathe or move, expose, you can relax. You can relax and move out of there, yep. All right, so that's your sternum. Now, so just remember, 2 different markers, 2 different SIDs, 2 different breathing instructions. The first one, expiration. Second one, full inspiration. But the one thing that's really important when you're doing a sternum, if you don't lay your patient down for the PA oblique, step them up. Have them pull themselves forward, flatten themselves. I have them put their chin, and I just make them really come forward. Because it takes the sternum, which is like this. If you're just standing here, look at where the sternum is. It's far, far, far away. Yeah, try to get that sternum as close as possible. So, all right, let's go ahead. Don't forget, you'll have to realign. You know, the tube will be out there somewhere. By the way, I'll tell you what, when you are